Thank you very much. Good afternoon, everyone. Another week and more statistics. Provincially, there were 4,447 cases added. It's been a stable number at around the 4,000 mark after we peaked at a 4,800 a couple of days ago. So it looks like there's a bit of a flattening, but again, we need to ensure that that continues that trend moving forward. Again, most of the cases come from the GTA area, and 233 were from Ottawa this time around. And so, in our area, again, we continue to see increased cases where we have a total of 510 active cases in our area with over 4,100 cases in total. Where we've got 33 hospitalized. Actually, it's 10 in the ICU. We had another one that was added now that didn't have time to be on here. And we had 90. We've actually had 93 deaths, and I know there was some question about it. We were at 88 last week. We corrected it, and then we added. There were four community deaths and one over the weekend. So there were five additional deaths added. That's why it's 93. Outbreaks, again, we had 15. And in terms of our rolling average, we can see that, again, we're sort of high end, but we're starting to see a bit of a downward trend. If you look at the change over the weekend, we added 109 cases over the weekend, 14 of which were in Akwesasne, 28 in Cornwall, and 22 in SDNG, and 45 in Prescott Russell. So again, still hovering up in the higher range. I'm encouraged today. We started the day with only several cases, which I think 8 cases so far. So hopefully this is kind of that 2-week period that we saw post Easter that we're starting to see the numbers go down, and that's encouraging in terms of, if that continues, that would be a very encouraging trend. As you know, more measures were enacted on Friday, and some were tweaked over the weekend, including obviously closure of the borders and initially closure of playgrounds, but now open playgrounds. But again, the stay-at-home order, very important to be able to continue those. The modeling at the table, on the advisory table, science table, show that people's mobility is very high. People are moving around, and that correlates directly with numbers of cases. And so the less people are mobile, the less cases. And we see it all the time. As soon as mobility went down, the cases went down. And that's our point. Our point is really stay home as much as you can. Don't gather with others. If you need to go to the park, take a walk on your own, but that's it. Take the children to the park and so on. But again, physical distancing, masking, and so on. Those have to be there. And in terms of our cases, again, we're still at more than 2/3 of our cases being the VOCs in our area, and so that continues to be a threat. And essentially, that's what's really driving this third wave provincially, not just over here. In terms of our long-term outbreaks, again, and congregate care settings, we still have St. Joseph's with 2 active residents, as well as Maxwell Manor with 1 active resident, and we have another group home and a retirement home with 1 resident. The retirement home with 1 resident, the group home with 4 open hands. So again, we are not seeing and provincially, again, we're seeing a decrease in long-term care and long-term care deaths, which again is a testament to the vaccinations. So speaking of which, we are now really revving up some of our vaccine clinics. Last week, between April 16th, April 10th to April 16th, we vaccinated close to 10,000 people in our mass immunization clinics. That doesn't include the clinics that the hospitals ran for us, and some primary care physicians that ran for us, and it didn't include, and over the weekend and late last week as well, our partners in EMS went to homebound patients as well as to individuals living in congregate living settings like group homes and lodging homes and so on. And that continues. So it's a mobile approach that continues. We are now in terms of our vaccine the clinics, and we're progressing, we have another 8 scheduled this week in mass immunization clinics across our area. We have actually had initially scheduled to May 2nd, that first week of May. Now through May 10th, because we've got a bit of our allocation. Again, we got our allocation only to the second week of May. We got our numbers were initially down with Pfizer. Now they went up with Pfizer. We had an additional addition of 4 trays, another 4,000 doses for the whole period, and which is good. And we were also told that we were likely get an increase in Pfizer, the Pfizer bump towards the beginning of May, because Pfizer has increased its rate coming to the province. So that's good. So again, we've added for the May 10th, we add another 8 mass immunization clinics to the ones we have already, because they were almost booked between now and the beginning of May. And we're also going to be doing some pop-up clinics like we've already done. We did one in Embrun last week. We're going to go back to Embrun the first week of May. We're also going to go to South Dundas. We're just trying to figure out what the best location is in the South Dundas area. Just on the phone with the mayor today. We have 8 primary care clinics across our area that either started or will start this week. We call them onboarding because we have to put them on this computer program called COVAX. And we're also now in talks with another 15 primary care practices over the next couple of weeks to provide them vaccine as well. So we are moving forward. Again, we're hoping to be able to continue this rate of vaccination as we move into more phases and vaccinating those individuals. Like I said, right now we are vaccinating 60 plus, and the other some of the phase 2 as well. We're still not in the full essential workers, but again, this is something that we'll be looking forward to over the next couple of weeks. And as our numbers go up, obviously our vaccine numbers go up, they will go up as well. So, and just one final word as well, as you've heard, as of tomorrow, the AstraZeneca vaccination will be will be available for people 40 and older. So that's going to add another opportunity to younger people to be able to get vaccinated at that point in time. Again, Health Canada does believe that the risks for the risks of getting COVID are higher, and complications of COVID are much higher than the risks of the vaccine. So the benefits outweigh the risks of this vaccination. So that's good news, because we do have 6 pharmacies that have AstraZeneca, and our primary care practitioners have it as well, in addition to Moderna that we're giving to our primary care practitioners. Donc, bonjour tout le monde. Je vais commencer avec des chiffres antérieurs. On a augmenté de 4 447 cas depuis hier. Donc, on voit la plupart des cas encore à travers le Toronto. Ottawa avait 233. Et ceci est un chiffre qui est stable, à mon avis, parce qu'on voyait les prédictions. Si on n'aurait pas un couvre-feu et les précautions sévères, les restrictions qui ont été mises en place vendredi et il y a 2 semaines, restez chez vous, etc., on aurait plus des cas, on aurait des cas 8, 9, 10 000 et plus par jour. Le taux des admissions soins intensifs est augmenté aussi. On est rendu à 750 à travers d'Ontario. Et ceci est un chiffre, très, très inquiétant, parce que ça approche à vraiment déborder nos systèmes de soins intensifs. Donc, je suis pas contente, mais je vois qu'on a un petit plafonnement. J'espère que ça va continuer. J'espère que c'est la pente qu'on a vue d'augmentation qu'on a vue la semaine passée était due au fin de semaine de Pâques, là, on a 2 semaines. Donc, j'espère qu'on va continuer à avoir un plafonnement et diminution, parce que c'est la seule façon, avec les précautions sévères qui ont été prises et en combinaison des vaccinations qu'on va continuer sûrement, c'est les 2 choses qui vont vraiment plafonder la courbe. Au niveau de notre région, on est rendu maintenant 110 cas actifs dans notre région, plus que 4100 cas dans notre région. On voit qu'on a 33 patientes hospitalisées, donc 10 sont aux soins intensifs. On a ajouté une tantôt. Donc, on a 10 aux soins intensifs dans notre région, qui vient de notre région. Et nous avons 93 décès. Je veux clarifier. La semaine passée, on a été rendu à 88, et après ça, 87. On a ajouté les 88 parce qu'il y avait un décès qui était initialement transposé à Ottawa. En tout cas, on était rendu à 80, on était 88 et vendredi, on a ajouté 4 cas de la communauté à 92 et pendant la fin de semaine, on a rajouté une autre malheureusement, donc on est rendu à 93 mortalités dues à COVID dans notre région. Ça, c'est triste, triste, triste. On continue avec nos flambées. Bien sûr, la plupart des flambées ne sont pas de façon qu'on avait, sont pas difficiles à contrôler et on a beaucoup moins de résidents. Je veux augmenter au niveau qu'est-ce que nous avons ajouté cette fin de semaine. Nous avons ajouté 109 cas depuis vendredi. Donc, on voit ici que 14 étaient de Akwesasne, 28 de Cornwall, 22 à SDNG et 45 de Prescott Russell. Et si on voit ici, au niveau des moyennes mobiles, on voit on peut voir un plafonnement ici et même une diminution de taux par 7 jours. Bien sûr, on est toujours dans la hausse rouge et même dans le zone gris ici, mais on voit que ça diminuer, puis j'espère que ça peut diminuer. En effet, aujourd'hui, on a commencé la journée, c'était une bonne journée comparativement. On a eu juste 8 cas d'ajouter. Donc, peut-être si on voit une débit qui va diminuer, on pourrait continuer avec une diminution. Et comme j'ai dit tantôt, au niveau de l'échelle provinciale, si on voit le plafondement ici et diminution, ça, c'est des bonnes nouvelles pour nous. Il faut dire aussi que 2 tiers de nos cas positifs dans notre région sont dus aux variantes. Et on sait que les variantes sont beaucoup facilement, ils mènent les personnes plus malades, augmentation de soins intensifs au niveau des chances d'être admis et aussi sont plus facilement transmis d'une personne à l'autre. Donc, on est rendu maintenant au vaccin. Il faut dire aussi qu'on continue avec le débit qu'on a augmenté la semaine passée. Entre le 10 avril jusqu'au 16 avril, on a donné presque 10 000 doses juste dans nos cliniques de massimisation. Et ça ne compte pas les doses qui étaient données aux hôpitaux et par la communauté. Il faut dire que cette fin de semaine aussi, on a continué. Les paramédics ont donné les vaccins chez les personnes au domicile qui pourraient pas, qui étaient immobiles à la maison. Et aussi, nous avons commencé à vacciner plusieurs maisons de groupe, maisons lodging homes, etc. Et ceci va continuer parce que ça fait partie de phase 2. On est rendu dans phase 2 avec, bien sûr, avec les personnes 60 et plus. On n'a pas rendu tout de suite tous les travailleurs essentiels, mais je pense que d'ici quelques semaines, on va être rendu avec ça. Au niveau des vaccins, au niveau des cliniques de vaccins, nous avons toutes les cliniques jusqu'aux premières semaines de mai étaient comblées. Donc, étant donné que nous avons reçu nos allocations, pas pour tout le mois de mai, mais jusqu'au deuxième semaine de mai, nous ont augmenté en total pour le mois d'avril-mai, on a ajouté une autre 4000 doses à peu près de Pfizer, mais je parle pour le mois prochain. Et donc, on a ajouté 8 autres cliniques pour la semaine pour la deuxième semaine de mai. Et aussi, nous allons, la première semaine de mai, nous allons faire l'autre clinique en brun et au Dundas Sud, soit à Morrisburg ou Iroquois. On est en train de chercher la place actuellement. Aussi, il y a 8 cliniques de soins primaires qui sont soit qui ont déjà commencé à vacciner ou qui vont commencer sous peu cette semaine et on est en train de négocier avec 15 autres dans notre région. c'est sûr que aussi, faut dire que au niveau des pharmacies, on a encore 6. Espérons qu'on pourra avoir plus. Bien sûr, il donne le AstraZeneca. Comme vous savez, l'AstraZeneca, demain, va être disponible pour les personnes 40 ans et plus. Je pense que les données, selon Santé Canada et l'expérience, surtout au Angleterre, qu'on a donné, je pense, 25 millions de doses d'AstraZeneca, le risque d'attraper COVID est plus élevé, les complications sont plus élevées que d'avoir le vaccin. Et c'est bien sûr que le bienfait de vaccin sont beaucoup plus que les risques. Donc, dès demain, ça va commencer à 40 ans et plus. Et nous allons continuer avec le débit avec tous nos vaccins. Et tout qu'on pourrait faire. Et puis, je pense aussi que étant donné que Pfizer va augmenter le débit avec lequel ils vont livrer les vaccins en mois de mai, je pense qu'on va être capable d'augmenter le débit des vaccins en mois de mai aussi, parce que ça a l'air que nos allocations vont augmenter avec Pfizer. So I'm just going to answer a few questions here and then take it to the media. I had some questions about the numbers. I've clarified those. J'ai clarifié les questions au niveau des chiffres. Nick Seabrook talks about concerns about sexual assault and domestic violence. Yes, we're very concerned about it. We do know that, of course, staying at home will increases it and will potentially make it worse. Again, there are mental health agencies that are working with in that domain. Again, unwanted consequences of it. On the other hand, again, you got to weigh what the consequences of not doing strict measures versus doing them. So this is exactly, but we have been talking about this for a while, mental health illnesses, people are fed up and so on. Another one is, if an individual has a strong reaction to the vaccine and gets chills, body aches, etc., does that mean that he already had the COVID-19 virus? No, what happens is, when you, particularly with the mRNA viruses, the vaccines, the Moderna and the Pfizer vaccines, the mRNA, it's the messenger RNA, it's the code that codes a certain protein, and our cells make that protein, and we trick ourselves into thinking it's we're infected. We're not, and so that's how we make antibodies, and sometimes there is that reaction to it. Most people that I've had Pfizer or Moderna have had the vaccines have had some injection site sort of redness and tenderness, and people feel a bit tired, a bit chills, but not more than that, and it goes away after a couple of days. But it doesn't mean you've got the infection. Your body has been tricked to thinking you have the infection, and then you make the antibodies, and then the next time you're faced with a real infection, then the antibodies are ready to attack it and prevent it. Angela King asks me from CBC Toronto, how many vaccines does your health unit able to administer a day, not taking supply issues into account? Well, Angela, if we had all of our 6 clinics running with fully staffed with full vaccines, we could do at least 1,000, actually between 1 and 1,500 clinics per clinic. We have 6 per day, so it's anywhere between 6 to 9,000 a day, and that's only through our mass immunization clinics. It doesn't count our doctor's offices and others. We have done that before with H1N1. We were able to vaccinate a lot of people at the same time. We didn't have a shortage of vaccine at that point, but again, it all depends on the vaccine, and it's a bit of a different type of a rollout of the vaccine, because we have to take into account requiring more space, and physical distancing and screening, so it takes a bit longer. But we very easily can do in certain clinics 1,500 a day, and if we run them simultaneously, again, you could get anywhere between 6 to 9,000 in one day of those clinics. Are the vaccine doses being given to pharmacies? Yeah, the vaccine doses being given at pharmacies have not been given to us yet, but they will be, and we will be adding them to our numbers of total vaccines, but not yet. The question about how many primary care providers, I asked that. Some of the primary care providers will also, in addition to receiving AstraZeneca, will also receive Moderna because they're going to be vaccinating individuals who are highest and high risk medical complications. That's part of phase 2. And in many situations, they're younger than the AstraZeneca is indicated. So that's why we want to give them Moderna as well. And I have a last one from CBC. Where is the EOHU in terms of vaccinations of residents and staff at retirement homes and senior residents? I can tell you that we vaccinated likely almost all residents at the retirement homes and senior and long-term care facilities. We vary between 100% and 50% in others, and we're continuing to vaccinate and offer our clinics to staff and essential caregivers in these settings. Jenna, that's it. We'll take the questions, please.
Thank you, Dr. Paul. Merci. Our first question comes from Thomas Stockton, TVC 22. Please go ahead.
Good afternoon, Dr. Paul. Can you hear me?
Yes, I can.
Lovely. So I have a question about the new restrictions and the fines that have come in. As you may have heard, we had a few incidents here in Rockland over the weekend. In one case, we heard a couple was sitting in their own driveway, speaking to their neighbours sat in their own driveway, enjoying the weekend weather and were fined. Another couple bumped into some friends in a car park going to the shops. They hadn't seen them in about 6 months, and according to them, spoke to her for a very precise 7 minutes before going into the intended store, and they got fined as well. I know you've said before about not looking at ways to bend the rules, but do you feel like this is the kind of behaviour bylaw officers should be fining people for?
That's news to me, Thomas. I'm going to look into that. I mean, if you're in your private property, anyway, I'm not going to argue about it. I just want to get. I haven't been made aware of these, but I will follow up.
Okay, that's great. Thank you, Dr. Paul.
Thank you.
Next question, Philip Blanchard, Morrisburg Leader. Please go ahead.
Hi, Dr. Paul. So you said that last week you were going to talk to Mayor Stephen Byveld about possible clinics in South Dundas, and a few minutes ago you said you've done this. Can you provide any other details about when approximately?
Yeah, we're aiming the end of April, the first week of May.
Okay.
And I was on the phone with him just actually half an hour ago again. We're just trying to figure out where the best place would be. We're looking at the arena. The problem is that it's built in the 60s and accessibility is an issue. Mm-hmm. So we're looking at ways around it. We're also looking at the high school and also looking at a few other areas. So we're actively doing on-site visits at this point.
Okay. And second question, the pharmacy supply is an issue. And I was talking to Jim McDonnell earlier today about this, but AstraZeneca supplies are being added to the system. Do you have any progress on getting additional pharmacies in the Eastern Ontario?
Not yet. We're working on it. We have asked to add, particularly in that area in Dundas as well, Ingleside as well. Jim and I are working on it. Now that we have a bit of perhaps looking at AstraZeneca uptake and numbers coming in, we've asked that we add more. We are told that potentially we can have as many as we have for flu, and we have 30 or 40 of them in our area. So I'm hoping that we can get some news on that. I'm actually having a 5:30 briefing with the task force this afternoon with all public health units. So perhaps we'll get a bit of an update then.
Okay, and a third unrelated question. The Leeds Grenville Lanark Health Unit and the Upper Canada District School Board and Catholic District School Board are partnering to do a presentation and public meeting on fentanyl use among youth in that area. Is this something that you're looking at doing in the EOHU?
That's something that we have done before, as you know, and we'll be considering that, particularly that we've had a lot of issues in the Cornwall area. As you know, we did a press release last week regarding the increased of overdosing in that.
Okay, great. Thank you.
No problem.
Next question, Bruce Cruz, TVC 22. Please go ahead.
Hello, Dr. Paul. How are you?
Good. Yourself?
Doing well, thank you. As you previously mentioned, Premier Ford rescinded on his total shutdown of outdoor activities and allowed playgrounds to remain open. In your opinion, what else needs to happen to allow for more physical activities and outdoor amenities to reopen?
Well, first of all, I'd like to see the numbers go down. I think that outdoor activities should be encouraged within limits, obviously. I know that my colleagues at the science table would like to see a bit more activities, restricted activities, albeit outdoors. I also believe that people are locked in and people are fed up. So just going out will do them good in terms of their mental health. So if you're asking me when we should be doing that, I think we should perhaps be looking at perhaps some allowing perhaps some sports and so on as we see the numbers go down. But at this point, I think people can go to the park, walk. The parks are open; they can walk. They can't congregate, and the kids can play. So, as you know, the other amenities of sports have been closed. You can't soccer fields and baseball diamonds. All these things are closed. But I do know that there is a will to, from the point of view of the science table. I was actually speaking to them over the weekend that eventually, we need to be looking at perhaps some very, outdoor safe activities. There's no question that, when you look at most of the super spreader activities, they're all indoor. And so outdoors is better. Again, very carefully. One of the risks that you have is that you don't want to start people gathering, people see and go in there. So you have to balance the two. But the way we are at this point, our mobility is so high that it's so much is a correlation between that and cases that we need to really stay home as much as we can. And if you want to go, take a walk in the park or take your child to the park, as long as you do it safely, don't mingle with others, don't gather, that's fine.
Perfect. Thank you, Dr. Paul.
You're welcome.
Do those joining by phone have questions? Press *6 to unmute. Ceux qui se joignent par téléphone ont-ils des questions? Appuyez les touches étoile 6 pour désactiver le mode silencieux. Those are all the questions for today, Dr. Paul.
Thank you. Merci.